heart. When it is closed, I may ask you to identify which is the right side and which is the left side. Our left side always contains the apex of the heart, so this here will be the left side. This here will be the right side. You'll also notice that on the left side, it's very, very muscular, so the walls feel thicker than the right side. Okay, so left side always has apex of the heart. Recall that in class we discussed that we may pin the coronary vessels and ask you to identify them. You cannot identify arteries or veins because they are not injected. Okay, so when I put a pin in any of these vessels running through here, it's just coronary vessel. You can't tell what it is, okay? Unless you have hindsight to when the sheep was alive. I don't expect you to. Okay, the next thing that our notes go through is epicardium, myocardium, and endocardium. So on these hearts, we do have the pericardial sac removed. The only place that I can pin the pericardial sac is on your preserved specimens, and that is that loose covering that's surrounding the heart. Okay, so epicardium, first tissue the pin passes through if I'm pinning the outside. Okay, endocardium, if I'm pinning one of the inside of the chambers, first tissue the pin passes through. If it's just in the middle, right, that's going to be the myocardium. All right, so left and right atrium and ventricle. So our atrium and our atriums are really small on the right and the left side. So they're these little tiny things up here at the top. Those are our atria, so really insignificant. So can you guys tell me on this heart, based on where, actually this one's easier to see, and I'm going to make it as easy for you guys to see as possible so that you can differentiate the different sides. So which side has my apex on this heart?
Left.
Very good. So which one's this? Is this my left or my right atrium?
The left.
Very good. Okay, so this side does not have my apex, so this is my right atrium. And we don't need to distinguish ventricles because you guys already told me, right? So these are my ventricles down here. Okay, so when we open it up, we can also identify, because this side has the apex of the heart, so this is going to be my left ventricle and my right ventricle. Okay. Interventricular septum will be seen on our cut specimen only. Interventricular, between the ventricles. Kind of makes sense. Okay. Anterior and posterior vena cava, we will just be doing that either on the model or on your cats that aren't dissected. The vessels are so small, it's hard for me to tell what it is unless I have like a probe and I trace it through the different chambers, so I don't expect you to know it. Okay, so pulmonary trunk, we will also do that on the other specimens. Pulmonary veins, aorta. We'll do coronary vessels, we already discussed. Okay, so on here, blood will come through my vena cava into my right atrium. So right side will come into here. It will then flow from the right atrium into the right ventricle through my tricuspid valve. So the valves here, they have our chordae tendineae. Can you see these cords down here attaching the valve to the heart? So they're going to prevent the backflow of blood through the heart. What is it called when you listen to heart and you hear abnormal blood flow?
A murmur.
Exactly. Good job. Okay, so once we're in our right ventricle, then we are going to flow through our pulmonary artery to our lungs. Once we're at the lungs, we're going to oxygenate the blood. We'll flow back from our pulmonary vein into our left atria, so little guy over here. Okay, we then go through our mitral valve into our left ventricle, and then from the left ventricle we are going to pass through our aortic semilunar valve into our aorta and out to the body. Okay. The one valve that I did not mention is that when I'm going from my right ventricle to my pulmonary artery, I do pass through the pulmonary semilunar valve. Okay? So that's the only one that I did forget to mention in the order of things. And it's good to know because I may pin a certain chamber and ask you where did the blood come from, what's it passed through, things like that. So it's important to know your theory for the blood flow as well with this. Okay, we already said the chordae tendineae, which prevent the valves from prolapsing and blood from flowing in the wrong direction. And I reminded you to see the pericardium and the pericardial sac on your felines. Okay, so now pretty much just the stuff that you're missing is the blood vessels that we can go through on the preserved cat. Does anybody have any questions about that?